This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
All right, well, good morning, everybody. When we take care of cardiac arrest patients, one of the big questions that we have is it a shockable rhythm? Because people who have VFib and VTAC tend to have much better outcome. They have a better chance of returning circulation and survival. So we care if they have VFib or VTAC, something we can actually treat. We can shock. We can try and get them back, try and get return of circulation. The way we usually determine if they have VFib or VTAC is obviously looking at the monitor. But there's this idea that a certain percentage of patients who look like they have PEA or asystole that we typically would not shock actually have occult VFib that you can't see on the monitor, but on ultrasound, you can actually see the heart fibrillating, and you could actually treat that as you would regular VFib. So there were some recent studies that tried to figure out how often this happens, and a couple pretty decent studies that, looked at, one of them looked at like 800 patients, showed that about 5% of what looks like asystole or PEA actually have VFib. So there's a lot of things that we use ultrasound for in cardiac arrest, and I think one of them, when we look at the heart during pulse checks, sometimes we'll see the VFib, and then it feels weird to shock what looks like asystole or PA. It's something, they do in movies, but we don't typically do. But if it is something that the heart looks like it's in VFib on ultrasound, you can shock it, and you can get, a good perfusing rhythm. So, it's one more thing to look for as part of a cardiac arrest, something we can treat, and the patients who you can shock out of it tend to do just as well if they had EKG VFib. So kind of something interesting, something to keep an eye on, more things to think about in cardiac arrest, but something you could actually treat. All right, thanks. Have a good day, everybody.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.